Bismillahirrahmanirrahim. Assalamu alaikum. A 70-year-old man come to the hospital due to worsening right upper quadrant pain, fever, and anorexia for the past 2 days. Today, he also developed chills. The patient was treated for acute diverticulitis 4 weeks ago. Medical conditions also include type 2 diabetes mellitus and hypertension. He does not use tobacco, alcohol, or illicit drug. The patient has not traveled recently. Temperature is 39, blood pressure is 130/80, pulse is 98, and respiration are 18 per minute. Examination show no jaundice. The right upper quadrant is markedly tender with some guarding on palpation. Bowel sound are normal, and there is no ascites. Laboratory results are as follows: hemoglobin 11.2 gram per deciliter, leukocyte 19,000, total bilirubin 1.7, aspartate aminotransferase 90, alanine aminotransferase 80, alkaline phosphatase 190. CT scan of the abdomen is shown in the exhibit below. So this is the CT scan of this patient, which show that there is a abscess which is hypodense on contrast. The blood culture are obtained. Which of the following is the best next step in diagnosis of this patient? So this is a 70-year-old man came to the emergency department due to worsening right upper quadrant pain associated with the fever, anorexia for the past 2 days. Today he developed chills. Patient was treated for acute diverticulitis 4 weeks ago. His temperature is 39. On examination, there is right upper quadrant markedly tender with some guarding on palpation. His THC count is 19,000. Total bilirubin is 1.7. Aspartate aminotransferase is 90. SGPT is 80, and alkaline phosphatase is 90. Based on these hints and the CT scan shown here, the diagnosis of this question is liver abscess. And for the liver abscess, the blood culture, antibiotic, and the next step to diagnosis of this patient is percutaneous aspiration. Percutaneous aspiration. So here the correct option is choice A, percutaneous aspiration. Pyogenic liver abscess typically present with fever, right upper quadrant pain, leukocytosis, and altered liver function test. It can result from direct spread from the biliary tract or from hematogenous seeding of distal infection, particularly those involving the portal system, for example, diverticulitis. Diagnosis require abdominal imaging, and management include blood cultures, antibiotic, aspiration, and drainage. Come to the incorrect one. Choice B. So malaria will not cause right upper quadrant pain, and hypoattenuating liver lesion on CT scan. Choice C, Echinococcus granulosis. So Echinococcus granulosis causes cystic liver lesion in individual exposed to infected sheep or canines. Cysts are typically visible on a CT scan as thin-walled septated lesion, occasionally with calcification. Patients are typically asymptomatic. Choice D and F. I will explain choice D and F together. So Entamoeba histolytica causes hepatic abscesses, and patients have a history of exposure in endemic area, for example, India and Mexico. Testing option include serology or stool analysis, for example, OA and parasite. Choice E, Clostridium difficile infection. So Clostridium difficile infection occur due to recent hospitalization and antibiotic treatment. However, Clostridium difficile infection is characterized by persistent watery diarrhea and will not be expected to cause abscess formation. Thank you.